Hi ladies, so my name's Tara Jones and I'm a nurse practitioner working in the Diabetes Centre at Goulburn Valley Health. Today I've been asked to speak about life post GDM and the risk of type 2 diabetes. So in my role in the Diabetes Centre at Goulburn Valley Health, I do work closely with the women that we see that currently have GDM. We see them from diagnosis through their pregnancy until their birth. So gestational diabetes is diabetes that occurs during pregnancy, and most commonly it resolves after birth. Sometimes there is underlying type 2 diabetes that was undiagnosed, and that may continue obviously post delivery, so it's not so much, and that's not GDM at that time. Occasionally, on rare occasions, type 1 diabetes has been diagnosed after pregnancy as well, but that is very rare. So the number of women across Australia and worldwide has doubled. The number of women having GDM has doubled in the past decade. At Goulburn Valley Health, we see probably 160 women per year. In 2010, there was 98 women. So there's a significant increase in our community of women that are being diagnosed with GDM as well. So during pregnancy, a glucose tolerance test is done at between 24 to 28 weeks. Generally in pregnant and high-risk women, it may be done earlier. And there's about 15% of pregnant women are diagnosed with gestational diabetes. So it's about 1 in 7 pregnancies. So it is quite high, the incidence of GDM. So some people you may know, or some family members may have had gestational diabetes during their pregnancy. Most commonly it does. Their sugars return to normal range after delivery. However, sometimes it doesn't. So there's some risk factors for developing gestational diabetes. Some ethnicities does increase your risk, so Aboriginal and Torres Strait Islanders. Some Southeast Asian countries do have a higher risk and higher incidence of GDM. Weight and BMI is a risk factor, either pre-pregnancy or if there's a significant amount of weight gain during the beginning, in the early weeks of pregnancy, that also increases your risk as well. If the woman's had previous hyperglycemia caused by some other reason, out of pregnancy, that can also increase the risk of getting GDM. And age, depending on what you read, age over 35 to 40 is also a risk factor as well. Other risks, if there's a family history, particularly a close relative of someone that's having diabetes, can also increase the risk of GDM during pregnancy. If the ladies had a previous baby bigger than 4.5 kilos, that does increase their risk of GDM, or not only GDM, but also does increase their risk of developing type 2 diabetes later in life, regardless of whether they've had GDM or not. So it is a significant factor to be aware of. If the woman has a history of polycystic ovary or thyroid problems or some other hormonal issues in the past, that is another risk factor, and some medications can increase your risk as well. So when the women are diagnosed with gestational diabetes, they are referred to the Diabetes Centre at Goulburn Valley Health, and we see them initially in a group and then follow up as a one-on-one appointment. So we keep in touch with the women at least once a week, depending on their glucose levels and their management. Usually we have probably about 35 women on our books at any one time that we follow up each week. So it's a pretty time-consuming job. So after birth of the baby, it is recommended that the women would have a glucose tolerance test at 6 to 12 weeks post-delivery. this has been questioned, but it is best practice and gold standard that it would be a glucose tolerance test. We know that this test is poorly attended for a number of reasons, such as having a brand new baby and plus or minus other children with you as well. To go and sit for 2 hours is difficult. Breastfeeding can be challenging, lots of challenges for these new mums. So it's not the ideal test, but it is still gold standard for diagnosis or follow-up post-GDM. So most people have a normal or normal results with their glucose tolerance test, and then depending on their risk factor, it's recommended that they be follow-up every 1 to 3 years with their local doctor. So this doesn't have to be a glucose tolerance test. It can be a fasting blood test or a HbA1c, depending on the risk of the woman and symptoms and what else is going on with her. But that is left up to the GP to follow up. We know that a lot of these women have poor follow-up. So initially after their delivery and then also ongoing later as well. So it is important, if you do know someone that's had gestational diabetes, just, maybe prompt them, ask them, have they had their follow-up? Where are they at with that? Because they do get lost in the system, and their risk of getting type 2 diabetes later in life or after GDM is really high, unfortunately, for these women. So the risk factor, the risk of getting type 2 diabetes post-GDM is probably about, it's around 50% of these women will have type 2 diabetes within 10 to 20 years. So it's a significant risk. And I know, and they're a difficult group to capture in terms of they're busy with young children, working, multiple pregnancies, breastfeeding, life, I guess. And it's a really busy time for these women. So it is difficult, but those first few years, it really is important for these women to have follow-up and regular assessments with their, for diabetes. So when you have diabetes, what it means is that your body can't process the foods as well as it could before. And in type 2 diabetes, it's insulin resistance. So your insulin, which carries your glucose into your cells and your muscles, it's the insulin resistance that's quite high. So your body thinks there's not enough insulin, so it produces extra insulin to try to use or utilise the glucose that you're eating. So, and a result of that is high or higher than normal blood glucose levels. So there's some factors that do increase insulin resistance, such as weight is has a big impact on insulin resistance, but other things as well, such as hormonal, which can be challenging to tackle as well. So type 2 diabetes does have a gradual onset. So often people don't recognise the symptoms straight away because it is slowly and gradually that these changes, and people do make excuses, or they're a bit tireder than normal, or they're being a bit more thirsty or whatever. They just think that it's part of ageing, not so much that it may be associated with diabetes. So feeling tired and lack of energy is a big factor. And these women that are with young mums with families and working and other demands of life, that everybody's tired, I guess. So being thirsty or drinking more than normal, and that's because it doesn't happen suddenly, it is gradual over time. People don't realise that that's actually occurring. Urinating is a problem, so getting up, particularly over the night, is a sign that there may be something going on. Vision, which is if your diabetes or you've had that for quite some time, or your sugars are quite elevated, would impact on your vision. But again, most of those symptoms, they don't happen suddenly. They do occur over a period of time, and people just sort of ignore it or put it down as, you know, part of the aging process. So diabetes is a gradual onset. So type 2 diabetes is diagnosed by a single blood test. So it doesn't have to be a glucose tolerance test, which is a 2-hour test in pathology. It can be done by fasting or a HbA1c, and depending on the results, whether that's diagnostic or if it is, if it's borderline, the doctor or nurse practitioner, whoever you're seeing, may want to repeat that result, just depending on the level that it is at. So yeah, pre-diabetes, which often can be reversed, I guess, has no signs or symptoms. So impaired fasting glucose, so someone that's got an elevated fasting glucose. So what that means is their insulin resistance is higher during the night and their liver's releasing extra glucose for their energy. They've got high levels of insulin, often bopping around in their blood, but their glucose is above target. So it's not high enough to be diagnostic of type 2 diabetes, but it is above target. And impaired glucose tolerance. So what that means is that your body's not managing or coping well with your glucose load. So the food that you're eating, your body can't process that to keep your blood glucose in target. So those two, if someone with pre-diabetes, those can be reversed. So with lifestyle changes, that can be reversed and the blood glucose levels can return to normal. There is a screening tool that the doctor or nurse practitioner can do, which is the OZ-D-Risk tool. So that looks at things like your weight, age, activity levels, family history, lifestyle, diet, those type of things to see, and it gives you a score to ascertain the risk of developing type 2 diabetes. So, and I guess using that tool can prompt the woman, or man, I guess as well, can, not just women, to change their lifestyle, make some adjustments to improve their glucose levels. So once you've got type 2 diabetes, it can't be reversed. You've always have type 2 diabetes. You may not need to take medications for it, but significant lifestyle changes often can reduce your blood glucose levels, but you still have the diagnosis of type 2 diabetes. So if you can, the people with pre-diabetes, with impaired fasting glucose or impaired glucose tolerance, they could, if we can target those people, to know what their risk is and know what changes to make to their lifestyle, that can reduce the risk of them developing type 2 diabetes. So diagnosis, I said before, was either a single blood test, or which is a fasting, or we do measure a HbA1c, which can be used as a diagnostic tool as well. A random blood glucose level sometimes can be used depending on the level of it. If that's borderline, it may need to be repeated. If it's significantly elevated, then that can be diagnostic as well. So type 2 diabetes does have a big genetic component as well. If you do have a family history of type 2 diabetes, then that can increase your risk. So a close family member, such as parents or siblings especially, that can significantly increase your risk of developing type 2 diabetes. So what we can do to reduce the risk, diet and lifestyle is really important. So healthy eating, and I know marketing, I think marketing has a lot to answer for, in terms of what healthy eating actually is. And food is very confusing for a lot of people. So well-balanced meals full of lots of vegetables and fruit. So watching diabetes is about the carbohydrate portion of your diet. So we don't advocate for low-carb diets, but certainly moderate amounts of carbohydrates, and watching how much or how many carbohydrates you're having with each meal and throughout the day. So lots of vegetables and lots of fruit. Snacks, I find a lot of people are a bit confused about what sort of snacks what are appropriate, and often that's where people fall. They may do well with their meals, eat good healthy meals, but often their snacks are not ideal. So it's changing what they're looking for in between meals can sometimes help tidy up their diet a bit as well. Having water to drink mainly, so soft drink and juice is unnecessary really in our diet and really shouldn't be a regular part of our intake. And I guess, healthy eating, so promotion with, to see a dietitian or to see a nutritionist for people that do need or would benefit from a bit of extra information about their diet. Being active every day, so ensuring that we're getting regular activity. And research has told us it doesn't have to be all in one hit, can be in regular, smaller amounts, so long as it is regular, and on most days that people would be active in some way or another. And I think people find it difficult finding something that they enjoy or something that they can continue that is sustainable, that they'll continue to do, not just for a short period of time. So with the reducing risk, we really do want these changes to be a permanent part of the person's life and their lifestyle so that they can continue on and that it is sustainable for them. Weight management, so ensuring or trying not to increase your weight regularly. So, we don't want people to increase their weight, a couple of kilos each year type thing. We want weight maintenance or weight loss can significantly improve insulin resistance. So it doesn't have to be a large, amount of weight if that's needed, so a smaller portion. So researchers tells us 5 to 10% of your body weight loss can certainly decrease insulin resistance and improve your glucose availability within the body. And when we see the women who have GDM, we do talk about their risk of developing type 2 diabetes and how to reduce their risk post their delivery. So ensuring that their diet continues to be sensible foods, keeping up their activity and making sure their weight is within a healthy weight range. And we do promote lifestyle changes to be made for the whole family, not just for the person or the individual that we're seeing. So we do promote, the whole for the partner and other children to be involved as well. Nobody wants to be cooking 2 separate meals for anybody. So, and because the baby of the woman who has GDM is at risk of type 2 diabetes as well, it is really important for the whole family to get on board with these changes that we encourage. Any questions?
I actually do have a question, Tara. My mum had gestational diabetes when she was pregnant with me. She is, I guess, lucky as well in the fact that she hasn't developed type 2 diabetes. But in saying that, would I be more likely to get gestational diabetes if pregnant because she had it as well?
I'm not actually sure of the research, but I would think so, yes.
Yeah.
So does your mum get tested regularly?
Yeah, she does. And there is history of type 1 diabetes and other health conditions in the family. She was pre-diabetic, but she's not anymore, which is
Good,
great.
perfect.
Yeah, so, but yeah, just wondering for myself, would there be anything that I would need to do to, you know, reduce my risks other than what you've spoken about, just in case?
It's really about, food, activity and weight is just so important, not just for diabetes as well. There's a million, different diseases that improves, but definitely for diabetes, and ensuring that you're healthy before pregnancy is ideal. So if you can, making sure that you are fit, you're well, your weight's under control before you are pregnant certainly reduces your risk.
Yeah, perfect. Thank you.
No worries. Okay, hi everyone. My name is Katie Thorp and I am a nutritionist here in Shepparton. And one of the services that I offer as part of my business is called the Life Program. So the Life Program has been offered in Shepparton before, but not for a couple of years now. So it's exciting to be able to provide it for, people of Shep again. It's a really, really great program. So I'm just going to take you through a few slides that might be of interest for you if you, if you're thinking of joining the program. So what is the Life Program? So the Life Program is a free sort of diabetes prevention program, and it helps to reduce our risk of type 2 diabetes, cardiovascular disease and stroke. So, and it, click the wrong spot. And like you can see, it's a free program for starters, which is a really excellent part of it, but it's sort of designed to assist you with lifestyle modification changes and to provide you with the motivation and the support to develop and sort of keep these healthy lifestyle behaviours and changes. So the program goes for 12 months now. It used to be 6 months, but now it's a 12-month program, which is really great. And during the 12 months, we cover lots of different topics. So like you can see there, the main topics being diabetes, heart disease and stroke, supporting healthy eating choices, also the importance of physical activity, looking at improving the quality of your sleep, stress management, and also goal setting and managing lapses. So, of course, even though we might like to set lots of really positive goals, lapses happen, and that's a really normal part of goal setting and goal achieving. So, there's lots of really wonderful parts of the program that I think people find really helpful when they're doing the program. So looking at what the Life Program has done here in Victoria, a lot of the other states are really envious of us because we do have this program and it's had such wonderful results for a lot of people. So the Austrix, as you can see there, over 80,000 people in Victoria have done the Austrix diabetes risk test. So that's just a quick little assessment which shows which places you either at high risk or moderate risk or low risk of developing type 2 diabetes. So if you are wanting to participate in the program, you do need to complete that Austrix diabetes risk test during the eligibility process. Over 60,000 people have commenced the program, and that's from across all of Victoria. So again, just like I said, we're really lucky now that it's being offered here in Shepparton again, because hopefully lots of people will really benefit from it. And what the statistics have sort of shown us is that by the end of the 12-month program, over 70% of participants achieved the fat and fibre intake goal. So that's about reducing the amount of fat that you're consuming, but also increasing the amount of fibre, which we know is a really wonderful way to eat and to try and really reduce your risk of diabetes. People's physical activity levels increased by 10 to 15 minutes per day, which is excellent. Of course, as a result of these couple of other factors, people's weight was reduced by 3 kilograms or so. Their waist circumference was reduced. And from all of that, the risk of type 2 diabetes was reduced by an average of 25 to 43%. So that's huge. That's a really, really big reduction. So it's great. And 98% of participants would recommend the Life program to others. So that's the most important bit. People are doing the program, but they're also really enjoying it. So I think that's a really important statistic. So apologies for this slide. It's a little bit sort of squeezed in because there was a lot of information that we were trying to include. But basically, this is how the sort of course runs over 12 months. So once you're deemed as eligible, and if you have been diagnosed with gestational diabetes previously, you are automatically eligible for the program. So that's great. So once you're deemed eligible, then we organise a one-on-one with myself, 45-minute introduction session. So this is where we go through questionnaires together, just so I can get a bit of an understanding about where you're at, you know, what your diet is like currently, your physical activity levels, etc. And that's the very start. And then we launch into the group sessions. So as you can see, there's 6 group sessions there. The first one is just a real overview, just to, you know, to get to know one another. And we talk about, you know, what type 2 diabetes is, heart disease, stroke, etc. The importance of changing lifestyle, looking at energy balance and portion control. And then we go on to session 2, which is all about nutrition and healthy eating. And then session 3, which is actually run by a really great local physio called Jane. And she talks all things physical activity and exercise, which is great. Session 4 is all about sort of stress and sleep and all that sort of well-being side of things. And then we have a break. So those first 4 sessions are done every 2 weeks. And then we have a break. And then we come together again at the 6-month point. And that's where we look at setbacks and we look at lapses and we talk about what's been going on. Maybe are there barriers that have been, you know, stopping you from achieving those goals? Set new goals again if needed. And then we break again, and then we come back together again at the 12-month mark. So the first 4 sessions happen sort of every fortnight, and then one at 6 months, and then one at 12 months. So like you can see, there's not a big commitment from you in terms of your own time, but everything is really integral, and it's designed like this for, you know, lots of specific ways, of course, but we cover so much really excellent quality information that helps you achieve goals that are sustainable and actually long term. So that's basically how the program is run. And just another point, each of the group sessions I make sure don't go for more than an hour. So currently with COVID and all the rest of it, all the sessions are online. So that can be really helpful for people because, you know, they can just be tuning in from the comfort of their own home. Whether we eventually go back to face-to-face, I'm sure we will eventually, but not for the foreseeable future. So currently all online, no longer than an hour. And generally I hold them at 7 o'clock at night, just so then, you know, the mums can come and hopefully babies are asleep by that time. So if you would like to join the Life program, you can, of course, reach out to the Diabetes Centre at GV Health and they will be able to put you in touch with me. You can contact Diabetes Victoria directly because they're sort of called our central referral team. So you can call up and say, you know, I'm from Shepparton, I'd like to be put into the, you know, into Katie's next group, and they will happily take that referral for you. So there's a few different ways in which you can become referred, but if you just mention Katie and Shepparton, then they'll know exactly where you need to go. So by all means, if this program sounds like something that you would be interested in doing, then please, get in touch. It's a really wonderful program and I think you'll, get a lot out of it. That's great. So thank you very much for this quick little introduction on the Life program. I hope maybe I'll see you all one day soon in a Life group. Thanks so much.